My name is Kieran Hand and I'm the consultant pharmacist for anti-infectives at University Hospital Southampton in the UK. University Hospital Southampton is a university teaching hospital. We have 1,100 beds and we act as a tertiary referral centre, so we take patients with specialist medical problems in specialties including cardiology, neurosciences, paediatrics, oncology. Well, in Southampton we used to provide doctors with pocket-sized guidelines, little booklets with treatment recommendations for antibiotics. But the doctors are often asked to carry many of these booklets, and they ask us, could we provide an electronic version, just a straightforward PDF that could be stored on their smartphones, as more and more of them were carrying smartphones. So the idea came about, why don't we turn the pocket guidelines into a smartphone application? And through one of our critical care doctors knew someone who worked in the industry, and we came into contact with Horizon Strategic Partners and worked on developing the smartphone application that would hold our antibiotic treatment guidelines, and that became MicroGuide. I'd say the reaction was overwhelmingly positive, although we started from a position of having paper-based guidelines which were difficult to find, often out of date. We then moved to a hospital intranet, but again it was difficult to find guidelines, and often they were long documents, sometimes 50-60 pages. And presenting the information in MicroGuide allowed doctors to very quickly drill down to the infection they're interested in, their type of patient, and the very specific information they need to make a decision quickly. So they were really pleased, and when we do teaching sessions with doctors, when we always ask them, do you know about MicroGuide? Are you aware of MicroGuide? Do you use it? And everyone puts their hand up straight away, and there are lots of positive feedback. What the benefit that MicroGuide offers is that previously we would have had to change paper copies, have them reprinted, have them distributed throughout the hospital, and make doctors aware, whereas with MicroGuide we'll make the change, and we can make that change instantly within a few minutes, and then we republish a new version of the guide, and each new version has a page called What's New in this version, and we list out the changes. So when the doctors next open MicroGuide, they see that a new version's been launched. They look at the What's New section and they realize instantly, okay, that antibiotic I used to use for pneumonia had now changed to a different antibiotic. And when they go to the pneumonia guideline, they see that that change has been made, and there's an alternative antibiotic recommended. And if they're unfamiliar with it, they just tap on the drug and it takes them to information about dosing of that antibiotic and any other important safety information that we feel they need. So it's a really effective way of dealing with these drug shortages and communicating change to routine practice very quickly and safely. Well, I also am a prescriber. I'm a qualified non-medical prescriber, and when I'm on the ward, if I need to use MicroGuide, the benefits I find are that I can very quickly find the information I need, that's treatment recommendations that are tailored to my patient and their circumstances. What infection do they have? Is it a severe infection or a less severe infection? Do they have any allergies, and what are the alternative drugs for allergies? Does the patient have good kidney function, good liver function, and if not, do I need to change the dose of the drug I'm prescribing? So I can find that information within seconds. I carry the information with me on my smartphone, so I'm not relying on finding a laptop or a desktop computer, and I can very quickly make my decision, go ahead and prescribe the antibiotic, and feel comfortable that it's going to work, it's going to be effective, and it's also going to be safe. We developed the decision support module prototype here in Southampton, and we were very keen to try and help doctors deal with the multitude of decisions that have to be made when choosing the best antibiotic treatment for a patient. So what the decision support module does is it presents the doctor with a single screen once they've selected an infection, if they've made a diagnosis, and then it asks them a series of very quick questions. For example, does the patient have a penicillin allergy? Does the patient have a severe or life-threatening infection? Is the patient at risk of a resistant infection? And for example, is the patient pregnant or not? And the doctor can very quickly tap the answers to those questions, and then behind the scenes an algorithm runs or a flow chart, and then the doctor is taken to the next screen, which offers a treatment option that is the ideal antibiotic option for that patient in those circumstances. Well, the flow chart for the decision support is contained within a simple Excel spreadsheet, and Horizon provides a template to hospitals who would like to use the decision support module, and really it's just a matter of editing the content of that Excel spreadsheet. There's very little in the way of designing any new decisions. It can be done with support if necessary, but often it's just changing the treatment choices so that they reflect the local preferences of specialists locally. Well, the main benefit of the decision support module is that it allows the clinician to tailor antibiotic treatment to an individual patient and their circumstances. A common criticism of guidelines is that they group patients into broad groupings that assume that they're all very similar, but we know that in real life patients can be very different. Some of them have allergies to common medications, some of them may be pregnant, some of them may have very severe or life-threatening infections, and the treatment choices we would recommend will change according to those circumstances. And if we were to set out all of that information in a guideline, it would be quite a long document, but the decision support system allows that all to be contained within one screen. The doctor makes the decisions, and then the system offers the optimum antibiotic straight away. Well, we do see the decision support module as also providing an educational role. There's been some concerns that the more you allow decisions to be made by computers, then the more you de-skill clinicians, and that's a danger that we are very aware of and would like to avoid. And so within the decision support module, on the screen where the doctor makes the decisions about the patient, each decision comes with a little information button, and if they press on that button, they find out more about the decision, how that decision is made, what's the background to the decision, and also what impact that decision has on the treatment choice. So the doctors can very quickly learn more about how making that decision is affecting the treatment choice, and they don't need to check that every single time, but they can do it to update their knowledge or refresh their knowledge if they need to. What I would say to other hospitals who are considering using MicroGuide is that this app has been so successful, and largely through word of mouth. The doctors have been recommending it to each other because they wouldn't use an app that wasn't useful to them, that wasn't helping them in their day-to-day job. And this app clearly is, because we can see from the uptake how many times it's accessed. So we see it's providing a very important service to the clinicians. From the organisation's point of view, it allows us to quickly get new information out to our clinicians and influence their prescribing behaviour safely and effectively. And really it's for a very modest outlay considering some of the other electronic systems that we've installed in our hospital. So I think it's a very cost-effective solution to some of the challenges we face of promoting good antibiotic prescribing.